I'm Ione. I'm the founder of Uplifting Content, and this is the second live stream of the day. It's a bombardment of live streams, but they're all incredibly interesting. And today, in honor of World Mental Health Day, I'm speaking to the wonderful Dr. Elizabeth McIngvale. So, Elizabeth, thank you so much for joining us today.
Absolutely. Thank you for having me. It's an honor to be here.
Awesome. First of all, we'd love for you just to talk a little bit about you and what it is you do, please.
Absolutely. So let's see. My name's Elizabeth, as you mentioned, and I live in Houston. I'm a professor at Baylor University and Baylor College of Medicine, which is where I see patients. I do all of my work in the OCD arena, so obsessive compulsive disorder and anxiety disorders. I was diagnosed at age 12 and have really battled on and off with mental illness my whole life. And, you know, it's been a journey. It's been one that I certainly didn't want or didn't ask for, but I've learned how to manage my illness and live every day. And I kind of just turned that into my life passion.
Wow. It's funny how sometimes the things that are most difficult in life just become these blessings, because without that, I'm sure you wouldn't be doing what you're doing and doing all these incredible things.
Absolutely. You know, I think the biggest slogan that I kind of live by is, you know, when I struggled, I really got stuck in the why. Why do I have this illness? Why am I struggling? And it just kind of really drug me down. And eventually, as I kind of sought treatment and learned to speak out and talk to others and share my story, and the first person that I felt like I helped, or the first person that told me that my story made a difference for them, it was all of a sudden there was some purpose to my pain. You know, there was some meaning to the suffering. And that absolutely was incremental in kind of my shift and my understanding and perspective of my life with OCD.
I think that I agree. I did a video about depression a few years ago, and a really amazing influencer with a big following shared it. And I had about 200,000 views of the video and inundated with messages from people like, "You've saved a life today," and "Thank you so much." Really amazing. These words with a big following shared it. And I had about 200,000 views. Oh, there's a weird echo. Thanks. Don't know what happened there, but thanks for fixing it. So it just feels so amazing when you know that you can help just by talking about that experience. Now, I saw an amazing video from you from years ago, actually, when you were really suffering with your OCD. Can you tell me just about how that was living with that?
You know, so first of all, I think, and you know, a lot of us that live with mental illness know, you know, I still live with OCD, and I learn every day to battle it, and I get better and better at it with time and with treatment and with age and all of that. But you know, when I was younger, I really struggled. I really struggled with the thoughts, the unwanted intrusive thoughts, and the rituals, and it consumed my entire day. You know, it got to the point where I was having these horrible intrusive thoughts, which are anxiety provoking, and they go against who we are as a person. And then I was engaging in these repetitive actions and behaviors almost all day long. And it was to a point, you know, before I sought treatment, for the first time, I went to a residential treatment program when I was 15. Before I sought treatment, I was literally engaging in OCD behavior every waking moment, you know, so from the moment I woke up until I went to sleep. And of course, sleep was extremely impacted and not very easy to get. And so, you know, it was a living nightmare. I mean, I think so many people in today's society label OCD incorrectly. So many people say, "I'm so OCD," or "I have a coworker who's so OCD," because they keep things organized or neat. And that's not at all what OCD is. OCD is a chronic, debilitating mental illness, and it is these horrible, unwanted, intrusive thoughts that really get to the core of who we are. There are things like, you know, what if something bad happens to someone we love? Or if I touch this, I could get sick and get someone else sick. And, you know, often people with OCD are very compassionate, very caring, and those sort of things are just not easy to brush off. And so what happens is we engage in these bizarre behaviors or rituals. So we think, okay, you know, our mind tells us to wash our hands or to, you know, check the stove an extra time or whatever it is. And you do this ritual and you actually feel better, but then the next thought comes and the next ritual happens. And before you know it, it's thought and ritual all day long.
So a couple of things. First of all, if anyone has any questions, please, if anyone has questions for Elizabeth, let us know, because we're keeping track of the comments and it would be great to sort of address anyone's concerns. So when you started seeking treatment, what was the type of treatment that you had, and what is the ongoing things that you now do to sort of keep your condition in check?
Yeah, great question. So at the beginning, I grew up here in Houston and we went from provider to provider and I wasn't getting the right help. People were doing talk therapy. They were playing board games with me, play therapy, kind of you name it. And it wasn't working and I was getting worse. And so eventually when I got the appropriate treatment, we went, my family took me to the Menninger Clinic, which had a residential OCD program at the time. And the appropriate treatment for OCD is exposure with response prevention, ERP. That is a specific form of cognitive behavioral therapy. It's very effective. We see efficacy in like over 75% of people. So it's a very, very effective treatment. It works really, really well. It's actually kind of beautifully done, although it's challenging and it's difficult. Treatment never is easy. It really works and the results are quite magnificent. And so that was the treatment I engaged in, and that's the treatment I still do to this day.
So could you give us an example of what that would like? Is someone that has like the compulsive behavioral disorder, and then how would the treatment work?
Absolutely. So let's just use one of the things I still struggle a lot with, which is fear of bloodborne illnesses or disease. And if I have the intrusive thought that I am, for example, I'm, on a walk with a friend and I see a Band-Aid in the park, and I have the intrusive thought that what if that Band-Aid is from, somebody who had a disease like HIV, hepatitis C, bloodborne illness. And so there's this trigger and anxiety. And so the ritual or compulsion might be to throw the shoes away, to Lysol, the car where the shoes touched or where I walked, to not take them into my house, or if I did, to clean that area, and to engage in all these rituals, which in fact reinforces the fear that in order to not have these thoughts, you need to do all these behaviors. Well, the exposure for that would be to, continue to wear the shoes, not throw them away, wear them in your house, wear them to work, wear them in your car, allow them to get different places, maybe even touch the shoe, right? And then not wash your hands right away, those sort of things. The important thing with OCD is that for appropriate treatment, people need to be engaging in exposures and response prevention. So if somebody with a fear of contamination has to touch this doorknob when they go to leave my office, and so they touch the doorknob, then they've done an exposure. But if they walk down the hall and go in the bathroom and wash their hands, they've undone this exposure. So it needs to be an exposure. So you face the fear and you resist that compulsive behavior or that ritual.
Wow, that's incredible. And so is that what you do? So you teach and so you see patients and clients as well?
I do, absolutely. So I see patients at Baylor College of Medicine here in Houston, and I engage in exposure with response prevention with all my patients. All my patients have OCD, and so that is the treatment that I use because it's what's most effective. And, it sounds really scary and terrifying, and I'm not going to lie, it is challenging. It is hard. If it's easy, people would do this on their own. They wouldn't even need to come to treatment, but we do it in a slow, systematic way, right? We don't start with the highest fear and the scariest thing. We slowly work our way up to those highest level fears so that you can conquer them all.
And someone just made a comment, sounds like torture. And I was going to say, like, how do you do, but yeah, I guess if you work your way up to something, then that's fine. How is it for you in that stage of, I can just imagine so much resistance, like what would be, so that's the technique, right? This is the system, is the exposure, and then when someone's really struggling with it, what's the thing that you do? Is it like breathing through it, or do you talk to them through it? Like, what is the thing that gets them over that hurdle? Or I can imagine sometimes people just must sit there for ages with it before they take the plunge.
Yeah, so, we do it together. So what's really important is that I would never ask a patient to do an exposure that I'm not willing to do. And so we do these things together and we work through it together, and you build this therapeutic rapport and you slowly work your way up. I think what's really important is that it's not a surprise. We don't throw an exposure on a patient. We talk through it, and it's a collaborative effort of things they've agreed upon and that we agree makes sense. It's really challenging. And what's really important with OCD treatment is we actually don't necessarily recommend like breathing techniques and coping strategies to lower the anxiety in the moment, because we want you to live with that anxiety and really experience it without doing any other behaviors to minimize the anxiety. And so what'll happen is you'll live with that anxiety and eventually it'll subside. It's much like if you go in a locker room that smells, if you turn around and leave, every time you walk in, it's going to smell again. Mm-hmm. But if you go in there, if you stay and you don't leave, eventually the smell goes away, right? You habituate. Your body will eventually habituate to this fear. For some people, it just takes longer than others, but it will eventually happen. And you will learn that you don't need to engage in these rituals to feel better.
Fascinating. Can you tell me how does this develop in people? Like, is there normally a why? I mean, I'm sure it's different for every person, but yeah, why does this tend
Great
to happen?
question. So it is a neurobiological disorder. So what we know and what that means is that people are born with OCD. Obviously different people can have different forms of OCD and it onsets at different times. We see OCD onset during childhood, adolescence, puberty, postpartum, all sorts of different times. But, people are born with OCD. It is not something that they kind of pick up or develop or because of their mom or because of their dad or the way they were raised. We're born with this illness and it just onsets or is triggered at different times in your life.
Wow. So you also say that you treat anxiety and with things like that. What type of treatments do you have for that? Is it a similar thing to the exposure?
Yeah, absolutely. So treatment for anxiety disorders, it's also cognitive behavioral therapy, often exposure therapy. Sometimes we spend a little bit more time when we're treating anxiety in what we call the cognitive therapy. So a lot of thought challenge worksheets where we're challenging these irrational thoughts and we're also challenging the negative behaviors or the negative reactions that individuals often have. But it's often exposure therapy and it's all cognitive behavioral therapy or CBT based.
Got it. This really gets me about living in America, the whole lack of accessibility for medicine. And, there's so much I see in downtown LA, there's so much homelessness and so much mental illness there. And it's like, what chance do people have when you need insurance to be treated, but you can't get a job because you're not there, you need help mentally? What advice would you give to people that, can't afford therapy or struggle with that?
It's a problem. It is our system's broken in that aspect. It doesn't matter what side of the political spectrum you're on. Everybody can agree fundamentally that mental health care is needed. It is something that needs to be improved upon and that every individual deserves access to appropriate care. Unfortunately, it's just not there. We're not there yet. And so there is a lot of resources in cities like Houston. We have an amazing public hospital here called Ben Taub, which has an amazing psychiatric center, which really is based and rooted in evidence-based and research-based care. And so, my biggest first step for everybody is always get connected with your local nonprofits. Mental Health America, MHMRA, NAMI, the National Alliance of the Mentally Ill. Connect with them and see what resources are available in your city, in your area. A lot of times we don't even recognize or realize what's out there and what's available.
Very good point.
That's really important. There is a ton of online treatment programs now. There's a lot of apps, but you have to advocate for yourself. I wish that wasn't the case, but you do. And so often when a professional says they don't take insurance, you can still file an out-of-network claim. You can still fight your insurance company for coverage and for care. And so there's options. You just have to advocate for yourself. And so often if you get connected with a nonprofit organization in your area, they can also help you with that process and help you better understand the system and how to work it.
Fantastic advice. Thank you for that. Now, you and your family are just so wonderful. Your father, Mattress Mac, has a mattress store and opened the warehouse. So when Harvey hit, he opened the warehouse for people that had been displaced and lost their homes and stuff like that. And you do a lot of philanthropic work. What's that about? How did that come about? Have you guys always been like that? Sort of, when did all this just generosity and kindness and action start? Most importantly, action.
Yeah, my parents have always been like that. My dad was raised in a very strong Catholic faith, and he's always been taught the importance of serving others. And, we were taught that as young kids. I mean, my sister, my brother, and I can all talk about the fact that Thanksgiving and our holidays, we were feeding the homeless. My parents always taught us the importance of giving back and that that's much, much better and much more meaningful than to receive. People in Houston certainly know my dad, and I think most of them don't, of course they know he owns a furniture store because he does a lot of commercials here, but most people talk very openly about my dad's philanthropic work that he's always done, and a lot of my siblings just really followed in his footsteps. When I got sick, my parents had the opportunity to not talk about it. They have a platform in Houston. A lot of families and people in Houston told them, don't talk about it, just get her well and move forward. You don't talk about mental illness. And my mom and dad never felt that way. They felt the complete opposite. They wanted to talk about it. They wanted to see if it would help other people. And early on, I realized sharing my story and helping other people gave it purpose and meaning. And of course I made a career out of it, but there's no greater gift than to give of yourself, your time, and the resources that you have. And so they've always been like that. And, I think Harvey exemplified that. People got to see firsthand that didn't already know it, especially people not in Houston. But for all of our family, it made sense. It wasn't even a shock. A lot of people keep asking my dad, why'd you do that? Why'd you open the store? And were you nervous about this? Or, all your furniture was going to be ruined. And my dad's answer is really simple. People were calling, they needed help, and they needed a place to stay. I didn't have a choice.
It's so beautiful. That's what I'm all about as well, is being of service and encouraging other people to be of service, because that's what I believe we're here for, and it just feels so good to do it. For anyone that doesn't know, check out Mattress Mac. We've been sharing some of the videos on Uplifting Content as well, so you can check out some of that. Elizabeth, can you tell me about some of your kind of ventures then?
Yeah, so absolutely. So while you're checking out my dad's Facebook page, on his page, you can see a mental health video that we did recently. So it has my dad, myself, Dr. Shah from Ben Taub, that Harris Health Center I was talking about earlier, and the head of psychiatry, Dr. Goodman at BCM, that we did. And it's an entire video focused on post-Harvey mental health. So the way that we're going to see trauma affect citizens of Houston, the signs, the symptoms, what to look for, what to be aware of. And so certainly check that out. But that's really what I do every day. I engage in a lot of advocacy and outreach, events like this. Today is World Mental Health Day. This week is National OCD Week. And so my job, my career is about spreading the word. It's about speaking openly and trying my best to do what I can to change the stigma associated with mental illness. On a daily basis, I teach at Baylor. I do research at Baylor. I see patients at Baylor College of Medicine, and I'm actively engaged in the OCD community and the mental health world, and I stay really busy. But every day at the end of the day, it's about, did I help somebody? Did I make a difference? And did I allow somebody with a mental illness for the first time to be heard, or to feel like there's help and hope available for them?
I love you. That's beautiful. How do you have time for yourself?
I don't need
Do you have time for you?
A lot of people worry about self-care and when do you take time for yourself. And I find that, helping others is very healing. So it might be, you might be really busy. You might not have a lot of time to slow down, but if you feel like you're making a difference in someone else's life, that kind of rejuvenates you, or at least it rejuvenates me.
Got it. So is it true that your mom was like, when you had your OCD, she was about you kind of fighting this yourself and finding the way? Is that true?
Yeah, my parents, we grew up in Texas, so we kind of grew up with this kind of mind frame of pull yourself up by your bootstraps. And of course, you need the tools to be able to do that. My parents had to find treatment for me and find appropriate help, but they really always went with this mentality of, you can do this, we're going to get you the tools, we're going to get you the treatment, but you have to do it on your own. And the reality, I had an amazing, amazing therapist. And I remember him telling me one day, he said, Liz, you can trust me 100%, and you and I can have a great relationship, and you can be willing to do all this therapy when you're with me, but you have to learn to be your own therapist. Mm-hmm. At the end of the day, you're the only one that wakes up with yourself, goes to bed with yourself, you're with yourself or in your mind every day, and you have to be able to take these tools and apply them on your own. Mm-hmm. And my parents really encouraged that. Now, I'm not going to pretend like they haven't or aren't still a huge support system for me. They always have been, they always will be. They support me, they help me when I'm really struggling. They, have always really encouraged me and been an active part of my treatment, but they've also at the same time reminded me that I am capable and able of fighting this on my own, and that's what I have to do. And, I couldn't be set up for any better success than by them having that mind frame, because it really taught me to take ownership of my illness, to accept it appropriately, and to learn to move forward.
Yes, I think that's so important. There was definitely a time when I was experiencing depression, and I was expecting my friends and loved ones to make me better and to help and to fix it. And so now, we often get messages on the page a lot because we talk about depression a lot. And so people will sometimes it's like people want you to fix them, and it's exactly like you said. I can't fix you. I can offer you tools and advice and guidance, but you have to make that stand, and you have to do it for you. So yeah, I'm a firm believer in that as well.
Absolutely.
How much is your faith play an important role in your life and with everything that you've gone through?
You know, an incremental role for me. So OCD kind of can have a faith component. It's called scrupulosity. And so when I was young, I really struggled with the religious form of OCD. So getting stuck in excessive prayer, you know, worrying about if God was upset with me, if I did something to upset God, having intrusive blasphemous thoughts, kind of all of these things. And so it always, not only was it a part of my OCD and mental health condition, but it's been a big part of my life. You know, for me, having a faith community, but also believing in a bigger purpose has allowed me to see that bigger picture. I think if I woke up every day and my goal was, today I just want to fight my OCD, and today I want to, you know, be able to just make it through and do this, it'd be really difficult. But when I wake up in the morning and I know, yeah, I have to fight my OCD, but there's a bigger picture to it all. God has a plan, and there's a meaning and a purpose. It changes my perspective and my understanding and my acceptance of the disease in a much different way. Faith for me has always, it's been a huge thing for me as far as being able to know that, again, that there's a purpose, that there's direction, there's this bigger plan when I never understood it. And it also was a huge protective factor for me against suicide. So, you know, I'm very grateful for my faith. That's for sure.
Wow. Elizabeth, this has been such a beautiful conversation. You are an amazing woman. Thank you for taking the time to talk to us today and sharing all of that.
Well, thank you. And, you know, I think it's not said enough, but I want to personally just say thank you for sharing your story and talking out about depression. And the reality is that, you know, mental illness is where cancer and HIV was 20, 30 years ago. And the more people that talk about it and put a face on it, we will slowly start to see that stigma wipe away. And so thank you for all that you're doing. I know the community greatly appreciates it.
My pleasure. Awesome. Well, have a great rest of your day. And thank you so much, everyone, for watching. Like I said, we've tried to tailor a lot of the content on the page today for World Mental Health Day. So check it all out, and I'll see you soon.
Thank you so much. Bye-bye.
Thank you. Bye.